The UK has recorded its highest daily number of coronavirus cases since late May. Government data over the weekend showed nearly 3,000 new cases in a 24-hour period. Thankfully, the number of daily reported deaths remains very low, but ministers admit the rise in infections is concerning. Here's the Health Secretary, Matt Hancock.
It's predominantly amongst younger people, but of course younger people can pass on the disease to their grandparents, and we do not want to see that. We've seen rising cases in other countries around the world, across Europe, often first amongst younger people and then passing on to others. And so it's so important that everybody follows that social distancing.
Well, over the last week, the number of new UK coronavirus cases reported each day has been rising steadily. But the figures announced on Sunday show a big increase, up by more than 1,000 on the day before. Labour's Shadow Health Secretary John Ashworth, Leicester MP, of course, says the rise is a reminder that there's no room for complacency.
This is deeply, deeply worrying. It's a reminder that we can't be complacent about this dangerous virus. We have to do everything we can to suppress it. But of course, this comes days after we've seen a fiasco over testing where people haven't been able to get the tests. So we're seeing the virus increase, but people can't get hold of tests.
Well, ministers insist testing has increased substantially in areas with local outbreaks. This may be one reason why case numbers are going up. Dr. Faria Ahmed is a GP. She says as schools and universities go back, it's vital young people stick to the rules.
We know that when kids go back to school, just in a normal year, we certainly see a spike in the number of respiratory infections. And, there's everybody knows about the phenomenon of freshers' flu as university students go back. So I think the concern is that as people are mixing a little bit more, then the number of cases will rise.
Sorry about that. Slightly computer doing its own thing. Sorry about that. Further afield, India has overtaken Brazil as the country with the second highest number of coronavirus infections. It's now confirmed over 4.2 million cases of COVID-19 and nearly 72,000 deaths. Only the US has more cases. Maybe it was Duncan playing a bit of ABBA in the background. Dr. Duncan Robertson from Loughborough University School of Business and Economics. Duncan, hi.
Good morning. Good morning.
Slightly unexpected. Anyway, look, OK, the figures are crucial at this time, aren't they? But they're showing lots of different things. Just talk me through it.
Well, I think that was a very good introduction. So the kind of concerning thing is that there are, the number of cases is going up. So as you say, just under 3,000 yesterday. And it's kind of quite difficult to make that comparison to, it's the same as a few months ago. Because, of course, if you look a few months ago, the tests that were being done were those who were, very badly ill and perhaps in hospital. And what's now happening is you're getting what's called this Pillar 2 testing, so community testing, where you go to a test centre and get the test there. I think the problem is, though, that we appear to be reaching the sort of maximum of the amount of testing capacity available, and that's obviously a bit of a concern.
Okay, so there is this strange phenomenon in the figures at the moment. The cases seem to be going up, but the death rates and hospitalisations are not.
Well, that's right. And I think, although, they haven't gone away, so I think, 124 patients were admitted yesterday. So they're still there. And, of course, there is this lag between, getting the infection and being ill and then ending up in hospital. And what we're seeing is the transmission is mainly amongst young people. And the good thing about young people getting it is that they don't tend to end up in hospital. But of course, if they do spread to their, parents or to their grandparents, then these are the people who will end up in hospital, given a few weeks' time. So we have to be, pretty careful about social distancing, face masks, washing hands, all that stuff that we've been going on about for months.
And that's obviously the key to it, isn't it? But it is persuading people that the danger hasn't passed is a difficult ask.
That's right, exactly. And, it is invisible and, people, there's no signal of people having it. You may have a cough, for example. But then, how do you know you've actually got the virus? Because, of course, what happens is you then go on to get the test. But if you have to travel just under 75 miles to get a test, you're probably less likely to do it than if it's, you're able to walk there. And, of course, home test kits seem to be running out. And so the risk is that if people don't get tested, they don't know they have the virus. And if they have the virus, that testing of their friends and acquaintances and contacts doesn't happen either. So it's a really kind of critical time at the moment, as you say, with schools going back as well, and potentially universities, and all this mixing that's about to start, and work as well. So, there's a potential issue here, and I think testing is the way ahead.
No, look, and that's an interesting point you make there, because of course, as the approach has very much been wherever there's an outbreak, more testing, clampdown as we know. Leicester was the first major place to have that happen. Does that skew the figures though? Because if you put an uplift of tests into an area that's having an outbreak, doesn't that then skew the figures and seem to look like there's more nationwide?
Well, there are two things going on. Absolutely. So if you test where there are high cases, then you're going to get a high number of cases. But the other problem is that if you don't test in areas which haven't had lots of cases, then you're not picking up the signals about an outbreak happening there. So, it's quite an interesting problem. Do you do most of your testing where there are cases? Yes, but you also want this sort of background surveillance testing going on, and so you don't want people to have any barrier to get a test and the results, and that seems to be what's happening now.
And what happens as we move forward? Is our sort of trajectory the same as in other parts of Europe, for example? We've seen France have quite a large uptick in the number of cases being detected. Is that something that we should expect to happen here?
I mean, with all these things, predicting what's going to happen is very difficult because, of course, if people do socially distance and do everything in their power to minimise the infection, then, that should prevent it spreading out of control. But, as you say, in Europe, various countries have seen this upward trajectory, and we're just starting to see the sort of upticks of potentially that happening over here too.
When will we know more, do you think?
Well, I think we just get information every week upon week, and every day we get figures showing the case rates in each local authority, and there is a trend to many more going up. This may be due to concentrated testing, but keep an eye on the case figures, and as you say, 3,000 yesterday. So the trend is definitely upwards.
Duncan, thanks ever so much. Thanks for coming on again. And of course, from your perspective, the university must be gearing up for welcoming the students back soon.
Absolutely, yes, exactly. So, more mixing.
OK, Duncan, thanks ever so much. Dr. Duncan Robertson from Loughborough University School of Business and Economics joining us here on BBC Radio Leicester, as he has done since March, and we're very grateful for it.